Last month, former Raven Torrey Smith posted an emotional blog that took his fans inside a very personal experience for him and his wife. He wrote about their doctor exploring the chance that their unborn child had trisomy 18. Smith explained that he first thought the doctor was talking about trisomy 21, Down syndrome. Then he jumped onto Google and realized that there is a difference.
Trisomy 18, your kid either dies premature birth in the womb or shortly thereafter. In rare cases, a kid can make it to a year, but the majority of the time, it's fatal early.
A barrage of tests revealed that Smith's baby boy doesn't have trisomy 18, but Smith's touching blog was the first time that some readers even heard of the condition. And joining us now to put trisomy 18 in focus is Dr. Manisha Patel, neonatologist at MedStar Franklin Square Medical Center. Doctor, thanks so much for coming in.
No, thank you for having me.
This is a very serious condition. Tell us about it, because I don't think, like Torrey Smith, most people don't even know what it is.
Sure. So trisomy in general just means that there's an extra copy of a chromosome. So the most common trisomy that most people are familiar with is trisomy 21 or Down syndrome. In trisomy 18, you have an extra copy of chromosome 18. And basically what that means is genetic material from either part or all of chromosome 18 that can cause underlying medical problems, significant problems that can affect the development of the heart, the kidneys. It can cause feeding issues, and it can also cause abnormalities in brain development.
And typically, these children don't survive.
Correct. So because of the complication of all of the associated medical conditions, oftentimes these developing infants don't survive the pregnancy. For those that do survive delivery, the life expectancy is dependent on the severity of these other organ systems that are involved. Most don't survive the first year of age. For those that do, that go into a couple years of age or more, they tend to have significant developmental delay and require assistance with day-to-day living.
And it's not preventable, it's just a birth defect?
Unfortunately, it's not preventable. It's a part of development. So instead of just having 2 copies of a chromosome, you get an extra copy of the chromosome, and that extra genetic material can cause abnormal development with major organ systems and the brain.
Now, is it rare? I mean, we'd never heard of it before.
Right. So in general, it is fairly rare, and a lot of the times those developing infants that have the extra chromosome of 18, often because they don't survive the pregnancy, we don't have as many live births of them. So in general, it's pretty rare. There are certain situations in which only part of the extra chromosome is passed to the infant. Those cases are called a translocation, and there's more of a hereditary link in those. So the risk of having a subsequent pregnancy is a little higher in those situations.
All right, Dr. Patel, thank you so much for coming in and explaining this to us.
Sure, absolutely. Thank you for having me.
Let's send it over to Mike and give us